Mountains may be high. Mountains may be high.
What's up, everybody? Andrewcast, episode 25. I'm joined by Ryan Acuna, the main man, and Yanna Savkova in the house right now, extraordinaire. And we're just coming off of a very exciting weekend in Philadelphia.
You're not kidding about that.
All around. The city erupted, but we're all here now. Everyone's safe. Some of us were out of town. Some of
we're safe for now.
Yeah.
Yeah, it's just
wait till Thursday. Wait till Thursday's over, and then you can say that.
Thursday's gonna be a little crazy, man. I don't know.
Yeah, are you going to that?
I'm gonna try. I don't know if I'm gonna make it happen, but we're gonna see. Fingers crossed.
Yeah. Well, it's definitely gonna be insane if you go there.
Me?
Yeah,
I don't know. The city's gonna blow up regardless.
Everyone's been waiting for this forever. That's it.
Yeah.
I've seen people crying. I've seen people saying it's the best day of my life.
Yeah, I mean...
I've heard a lot of that.
Best day of my life? Would you call it that, Ryan?
It's definitely up there.
Yeah.
I've argued with myself of whether this is... what was it, Sunday? I argued whether that was the greatest day of my life. Because I've been a fan for, 13 plus years. I got really into it when I was about 10. And I never really thought they would win. I never really
He's a non-believer. He's a non-believer.
I wanted to believe. It was just so heartbreaking every year, the same old story, and now Here we are, Super Bowl champions. It still feels like a dream, personally.
Mm-hmm.
Yeah, I mean, I haven't really come from a big football house, but I understand the significance. So I was just kind of like witnessing people get really happy and just really looking at it from like an objective Zen kind of sense of like, wow, as humans, like we really relate to the sport very strongly.
Yeah.
What about you, Yanna? You come from a household of Eagles fans?
Not really, but I'm certainly a fan of our team. I just can't really say I'm a fan of all of our fans right now.
Ooh.
They're giving us a bad name.
In what way?
So I'm living in Minnesota now. And we got this nickname Minnesota Nice, right? So everyone's nice to everybody else. Can I do anything for you? You want to come over to my house? And so when Minnesotans were out here, they were getting full beer cans thrown at them. Like, little kids were getting pegged in the face. They're seeing all this, like, Philly kind of rough and tough lifestyle, which is, it's what Philadelphians are. But it was definitely, like, hitting Minnesotans hard to see that.
Yeah.
And
definitely big contrast between how they approach games.
Culture shock.
I feel like
that's
a big
culture
word.
shock, yeah.
we were talking about this a little bit on the way over. You were smack dab in the middle of that.
Yeah.
Yeah. Were you bullied at all?
Out in Minnesota, we that Vikings game was a little rough as an Eagles fan. Wore my Eagles gear in the bar and didn't get too much rough and tough about it. Actually, I was a little concerned, wearing Eagles gear when everyone else is in Vikings. But it turned out fine. Everyone was actually like, man, giving you a hard time. But that was a good play. Like, good job, Eagles.
So that's the Minnesota Nice. Is that what you're about to say?
Yeah, I was just saying, so it wasn't really shit talking.
No. I don't think that their version of shit talking comes anywhere near Philly's version.
Just to talk about the reverse of that, just the debauchery that I witnessed Sunday night. I'm sure a lot of people have stories. What are those, like, they're not traffic cones, they're like kind of like guard things on the road where it's like they're, what I'm talking about? They're like white and there's a whole bunch of them. They're just like straight up like sticks.
Just to make sure cars don't go through?
Yeah, so
okay, like
and they're kind of
they
kind of have like a weight system to it. So if you smack them, like they go back and forth. So this guy goes, yo, this thing is Tom Brady. And he starts boxing it in the street. He just, like, starts punching it. And people gathered around him and were like, yeah, man. Like, you give it to that thing. He's just punching this thing, dude. That was one of the funny things I saw. And then, what else did I see? Oh, yeah, so everyone was contributing to the madness. And I saw these kids, like, what are we going to do? Like, I put this on my Instagram story, like, to contribute to the debauchery. I keep using that word. I hope I'm using it correctly. So they take a dumpster and they just push it into the street. And that's it.
My goodness.
They just walked away.
I mean, I heard about flipping cars. I heard about people doing backflips and hitting their heads. Like, so what are you guys doing?
I think one of the...
just one and you're going to hurt yourself?
Yeah.
All
one
for
of
a
the
Graham
crazy
story,
things they
apparently.
were doing. They were jumping off the awning of the Ritz-Carlton, doing, like, trust the process, trust falls.
Yeah.
So, like, falling off of the awning above the building is just crazy.
Yeah, and, like, I'm pretty sure no one caught them. You know, for as much trust as we have of the process, no one caught them.
They got caught a lot, actually. There were a bunch of people that did get caught, though. I'm sure no one walked away uninjured. I'm sure there were people that did get hurt.
The biggest surprise I had, we talk about Minnesotans being nice, and we also talk about Philadelphia not being nice at all. And what the biggest surprise to me, past all the backflips, past all the poles being destroyed, past, all this other craziness happening, was that people were being really nice to each other. High fives, smacks on the butt, hugs. People were hugging.
Smacks on the butt.
I saw it. People were hugging each other. People were hugging and crying in each other's arms.
Yeah, I was getting hugged by strangers.
People were giving high fives driving down the street. They were driving and just had their hand out, and people were just smacking the entire time.
So the unity is the silver lining to this cloud of destruction.
I just don't understand it. This is not
City
Philly.
of brotherly love, though. Brotherly love. It does run pretty deep. And, I mean, statistically speaking, we got less arrests, less injuries, less reported statistic evidence that we were, up in Boston. They did a little bit more roughhousing than we did.
Okay, so by the numbers, you're saying Boston is definitely worse than Philadelphia.
If you're talking just by numbers, yeah, we got a little bit biased by the media, I think, on that one. But
I was gonna ask about that. Like, I heard that there were 50,000 people. That sounds like a bit excessive out. But I wanted to know, like, how many fatalities there were. Like, you know what I'm saying?
I would have to look up the numbers. Yeah.
Did anybody die?
I hope not.
I hope not.
Not
either,
that I heard
but,
of.
I think people got injured.
I feel like that'd be somewhere.
I think Mayor Kenny actually was quoted saying he believes that there were like 3 arrests or something like that, but he said that it was an unofficial report that's not finalized yet. He's not sure, but that's an incredibly minute number for the number of people that were out that night. That's impressive.
And a number of illegal things. I definitely saw more than 3 illegal things happen.
Yeah, for sure.
It kind of makes you wonder though, like, if people disobey the law on such a mass level, what can the cops really do about it? Like, if there's 3 arrests in this scenario, imagine if that was just a random day where we all decided to break the laws.
Well, I think that's part of the reason why people got away with things is because the force knew that no matter what they did, they weren't going to be able to contain everything. It was more of a matter of making sure that people lived, people didn't get hurt.
Yeah.
Property was reasonably maintained. Because what else could they do?
Right.
With a mass of, you're saying 50,000 people.
Right. But it also makes you think, like, if you were going to commit, like, a sincere crime, like to rob somebody, that'd be the night to do it.
I guess. I'm sure people, there's people, profiteers everywhere that take advantage of that kind of stuff.
There are videos of people looting Wawas, which why you'd ever go after a Wawa is beyond me.
That's just a crime in Philly.
That's just tragic.
They should have been arrested just because it was Wawa.
Right. So I'm sure there was some of that debauchery going on.
Yeah.
But,
I like that word, debauchery.
It's a good one.
So,
did I just botch that? Debauchery?
It's like, maybe it's just your spin on it.
I've heard botch, like you're botching it. Debauchery. That's my take on it.
So what I'm getting from that is there's a bunch of different ways to say it.
Yeah.
There's a lot of ways to say things in Philadelphian. There's a lot of ways to say things in Minnesotans.
Yeah, so tell us and the audience a little bit more about yourself, Yanna. So you went to Temple University, and now you're in Minnesota. Can you talk about a little bit about your journey? Just real quick, everyone, Yanna is an EMT. She's a firefighter, now a nurse at the Mayo Clinic. Aspirations to be a flight medic somewhere down the road. But can you just start about your humble beginnings? Maybe steer us into Temple, how you got into Mayo, and anything else you find interesting about it.
Sure. So I guess like Twitter version. I grew up in Allentown, which is about an hour north of Philly. So been kind of an East Coast person all my life, Northeast Pennsylvania. Went to high school up there. Kind of didn't really know where I was going. I liked medical. I liked helping people. My mom is actually like totally afraid of the sight of blood. Like she'll literally pass out if she sees blood. Taking her to the doctor is like a big ordeal. She'll get like the whole white shakes, like sweating kind of thing. So the fact that my sister and I were both into medicine was like, are you sure you're not adopted? Like, where'd you guys come from? But it was kind of in high school that I really got started, I guess, down my path personally. I had a boyfriend at the time who passed away from a heart condition. We weren't dating at the time, but it was one of those like, wow, it really hits home. It's like one of those like, I wish I could have known. I wish I could have done something. I wish I could have seen something. And even if I couldn't have been there to prevent it, I wanted to be doing more than I was at the time. So I essentially like went down to the fire department and I was like, guys, I need to have signed up for an EMT class yesterday. And they were like, okay, all right, stand by, we'll get you some paperwork. And as I was like standing by waiting for them to kind of get me some information, I was, taking a look around the fire department and I was like, I could probably reach more people doing this too. Let me sign up for this too. So I was 15 turning 16 at the time. A year later, I was in the EMT class and I was running with the fire department, volunteer. So I got my EMT in high school and was running with the fire department in high school. I met two really cool guys through the fire department who are basically like my mentors. They kind of took me under their wing and were like, yeah, we'll show you everything, follow in our footsteps kind of thing. And their names are Kish and Clybe. And Kish is a flight nurse and Clybe is a flight medic. They're total badasses in my book. And just
a flight nurse, flight medic?
Yeah, so there is a difference.
Okay.
Yeah.
Can you just tell us what they are?
Yeah,
Sure.
I was going to ask about that in general. I have no idea.
Absolutely. So a flight medic, you become a paramedic first. You're and there's actually a difference between an EMT and a paramedic as well. So I guess there's kind of three terms that we kind of need to lay out. So EMT, emergency medical technician. You go through a course and you run on the ambulance. Paramedic, essentially similar, but they have a lot more tools in their arsenal, so to speak, as far as treatments.
So correct me if I'm wrong, but just to put it really bluntly, EMT is basic life support, whereas paramedic is advanced life support, if you're going to put just into words.
Absolutely.
Okay.
Yeah, exactly. That's exactly right. So kind of in the hierarchy, it's EMT, paramedic, nurse. So flight nurse, you have to be a nurse first. Flight medic, you have to be a medic first. Then you go through, further education to get onto a flight team.
And a flight team is a firefighter that's also a paramedic? Is that kind of what it is?
Not quite.
Okay.
You're close. Most flight teams are comprised of a flight medic and a flight nurse working in tandem. So those are the two that are the medical trained, and then of course the pilot. And so that is the most recognized configuration, the most common configuration of providers on the helicopter for a flight team.
Okay.
Currently. So
where, you said this is in Allentown, right?
Yep. Yeah.
So-
So they work for Lehigh Valley Medevac.
Okay, I was about
Which
to
is-
ask where they're doing this at.
Yep. Yeah. And Clybe, Mark Clybe Scheidel is his full name. He was in the Air Force first for a while. He's also on a SWAT medic and kind of ended up getting into flight medic territory as well. And then James Kish. So Kish is a flight nurse and firefighter, and it was involved in the ambulance corps. So I kind of met them through both firefighting and EMT. And I was like, wow, that is everything I want. I want that high adrenaline. I want to be there when someone needs me. And I want to actually be able to make a difference, make an impact, help somebody. And I saw them doing that, and I was like, that's it, right there. So
That's super dope. So, like, not only did your mentors, like, really teach you what you were getting into, but just being around them made you want to do what they were doing.
exactly. Yeah, I mean, to see it firsthand is... The first time I saw them in action, it was like mind-blowing. It was like, wow, that is what I want.
Was it? Yeah, that was your moment. Was it the first time you saw them in action that you're like, I want to be you?
I don't think that anyone ever really falls in love with something at first sight. I know that that's like a really cliche thing to say, like you fall in love at first sight. I think it's an accumulation of things. It's the consistency and the drive and the passion that you see on every call, every time someone needs help, and every single, image that I have of them is just consistently being there and consistently being a hardworking badass. And I guess it was an overtime kind of thing.
That just seems like a position where you're helping a lot of people, but how risky is it for the practitioner, for the actual flight medic? I mean, like, what kind of dangers could befall you?
Yeah, it is one of the more dangerous professions out there currently. Going up in a helicopter doesn't come without risks, and there are several crashes that occur.
So you're obviously not afraid of heights at all.
No.
Okay, because that would be a huge hurdle.
I would imagine so, but I have heard stories of like EMTs and medical professionals overcoming the fear of blood, overcoming like nausea over medical things, and still being able to provide care. So
Yeah.
I'm sure I'd be able to overcome it, but thank goodness I don't have to.
Yeah. I mean, there's always going to be something that's not easy for you when you're starting out. Can you talk about something that was hard for you to overcome?
Oh gosh. Honestly, probably the move to Minnesota has been pretty challenging for me. I love going new places. I love starting new challenges. But this is very far away from Pennsylvania.
Yeah.
And, I like to consider myself a bit of a city girl. I mean, going to school in Temple and you guys know, running around and being so close to access to everything that's there. Rochester, Minnesota is not nearly as big as Philadelphia. It's about an hour south of Minneapolis. And so Minneapolis and St. Paul are the twin cities up there. But Rochester is a little bit smaller than I'm used to. And it is a heck of a lot colder than I'm used to. And that kind of takes a toll when you're starting over and you don't really know anybody and you're trying to make your way through and start a new job and figure out adulting, and all of that has been fairly challenging.
It's a lot of work, and people, when you say like, oh, I'm moving, like a lot of times in people's minds it's like so simplified, like, oh, you're just gonna live in another spot, but it's like you literally got to start your life over to an extent.
Yeah.
And you got like stuff that is going on at home that you're missing with your friends, and like that whole thing is going on in your head. Like, I'm missing so much stuff, and so there's a lot attached to that. Yeah.
And I mean, my twin sister is back here in Pennsylvania, so I'm far from her. The fire department, the ambulance corps that I started with, they're all back here.
Yeah.
I was just telling Ryan, I just bought my first car ever out there.
Congratulations.
Yeah. First time like paying rent on an apartment. I mean, being an RA, we didn't really pay rent, so it was kind of nice. But it's just a lot of new. So it was a fun challenge to kind of start.
Are you running EMS down there?
I am, yes. I found a volunteer organization, Chatfield Ambulance Corps. They're all volunteer, and I get the chance to keep my skills up and keep helping the community and doing that kind of thing when I'm not working in the hospital. Is there
anything significantly different that you had to get used to between PA EMS and Minnesota EMS?
Oh, absolutely. It is a completely different world. So where I ran in Allentown, and then I also ran with Temple EMS in Philly, you're in a city, right? So the closest hospital is 30 seconds away. The farthest is probably 15 minutes away. So that's not a long transport time. Out in Minnesota, we call it rural EMS. So we're about 30 to 45 minutes away from the hospital.
Oh my gosh, man.
Yeah. So you kind of have to do what you can with what you have right there.
It's more of a MacGyver type of thing.
Yeah, and so because of that, Minnesota has what's called variances for EMTs. So remember how we were saying an EMT is like basic life support and then a paramedic is advanced life support. In Minnesota, because we're so far away from the hospital, they have variances that allow an EMT to kind of work in that middle section. So we have a few more tools in our tool bag that we're allowed to provide because of that distance, because of that challenge of time that we now have to provide more for the patient.
Whoa.
So
what's the biggest? So I'm assuming that these extra tools you have, quote unquote, are related to the problems that you find in Minnesota.
Yeah.
Can you talk about some of those problems? I mean, I know in Philly we have a huge heroin epidemic, and that's something that's talked about all the time in just the tri-state area.
It's in the burbs too.
Yeah. It's the tri-state area.
And it's definitely spreading. So I think started kind of on the coasts, and then of course big cities started getting hit. And it really has made its way throughout the country. And so when I first moved out there, I was like, oh man, I'm in the middle of nowhere. I'm not going to see anything like I did when I was in the city. We joke about seeing all the like fast action gunshot stabbings, blah, blah, blah. But being out there, I've seen pretty much 90% of what I saw in the city within like the first 6 months of being in rural.
Really?
So,
Like violence, like stabbings and
not so many stabbings and shootings,
Okay.
but definitely the drug problem is not isolated to cities.
Right.
Assaults, car accidents.
I feel like you'd be more inclined to do drugs in rural areas.
There's nothing to do.
Yeah.
That's a nice way to say it. I mean,
no, I mean, it sounds fucked up, but like we all had friends that went to colleges and middle of nowhere.
Yeah.
Like I think you're Penn State, I think in PA, like a Bloomsburg. Like
Yeah.
I talked to my friends that went there and they're like, "What'd you do?" "Oh, it's a party school. We just get fucked up all the time." You know,
Yes.
and like
Hey, man.
drinking's one thing, but hey, sometimes that leads into other things.
Absolutely does. Yeah. So it's we definitely have the ability to start IVs out there. We do, when we talk about medicine, you talk about the ABCs, so airway, breathing, and circulation. Those are the first three things that you want to get down in a person to start stabilizing them. So we have a couple of advanced things we can do with airways. Just things that an EMT in a more populated area isn't capable of utilizing.
Is there any like standout cases that you've had so far moving down there, like unusual calls you guys got, or?
Yeah, I mean I've never had an ambulance issue like driving and trying to get somewhere until I really got out there. We've definitely had to ask dispatch a few times. So wait, the red house past the green house. There's nothing out here. What are you talking about? Got an ambulance stuck in mud for the first time. That was interesting.
On the way or coming back?
On the way.
Oh no.
Yep.
I don't know which is worse, to be honest.
I would be panicking. Either way, back or forth. That's true.
Yeah. It's definitely, there's a lot of dirt roads out there, so it's kind of challenging.
Yeah.
And then we actually did have our first MCI out there in, I think our director said something to the effect of like 30 years. So an MCI is it stands for mass casualty incident. Doesn't necessarily mean that there are deaths. Casualty deaths not necessarily the case in an MCI, but it's when you have more patients than your ambulance corps can handle. So we had a school bus flip over because it was icy.
Whoa.
And so the logistics of kind of handling that with such a rural organization was really challenging and interesting and kind of neat to be a part of, because I've seen it in action in the city, but doing it in rural life is completely different. So that was a pretty interesting one.
So did you guys have to like cut open like the roof of the bus, or probably a simpler way?
I actually wasn't on call anymore when that happened. So I was not the first one on scene by any means. The guy that I was kind of hanging out with at the time, we were down in Chatfield, and we heard it come over the radio, and all we heard was for a school bus on its side, and we were like, we're just gonna head to the ambulance corps, pick up the second rig, and we're gonna meet you guys out there. And they're like, yeah, please do that, thank goodness. So we kind of rolled out, and the bus is facing the wrong direction on the other side of traffic, and it's upside down. And there's like a few people kind of milling about. There's like 2 other ambulances on scene, and we ended up taking, I think, 5 or 6 people in our ambulance on that one.
How young were the kids in the school bus?
They were about high school age.
Okay.
Were any of the injuries significant?
We use like a color coding system when you have a lot of patients that you have to we call it triage. And there were yellows and greens. So there was no reds, which is the most significant. So it was more of a logistical battle than anything, just trying to make sure that patients got to the hospital, got checked out. You don't want to miss anything on something like that, because it could be catastrophic if you miss it. So
Right. Red is like close to death. Like.
Yep.
Sheesh.
Yeah. So we were there. Everyone was very lucky on that one. It was just kind of, whoa, there's 30 people that we need to get figured out where they're going, kind of thing. So
I feel like majority of, if not like health related, you'd just be responding to like a lot of accidents, nothing like crime related. More in Philadelphia, obviously, like just that kind of stuff.
I mean, there's a lot of, accidents and chronic illnesses that people need to be transported to the hospital, but I wouldn't say that there's no crime. There's definitely been a few calls that I've been on already that are related. So.
Dang, you're involved with some pretty crazy stuff. You probably have just like, I don't know, a wellspring of experience that a lot of people your age don't have when it comes to stressful situations and people probably emoting out of control, just really like losing it, you know, and being calm in that situation.
I've gotten to have a front row seat to a lot of people's life.
Huh.
Yeah.
That's I don't know. That's a very interesting perspective. And I guess one that is kind of inevitable to gain when you're going into stuff that, you know, you're involved in too, like the medical field, as you kind of see.
She's definitely more action-ary.
Yeah.
You know, she's right in the front of it.
Like a rescue hero.
I don't know about that.
Yeah, she's cooler than I am. Let's just leave it at that.
But I feel like when you deal with people in situations like that, like you get to see another side of humanity, which is, you know, like every day, like, you know, you talk to people and everything's very subdued and calm, and then you see just like people fighting for their lives or really, really panicking, and it shows you just like the range of mindset and like the craziness that can occur, you know?
Yeah. I mean, I mean, I'm in the healthcare field also, just a different end of it, and I think some people go into medicine for the medicine, like, you know, seeing the pathologies and seeing the cases, and some people go in to find out about the people, to figure out what their lives are about. Where do you think you fall on that spectrum?
Yeah.
I am so lucky because as a nurse, I get to do both. And especially in the ICU, you know, things are incredibly medically driven, but you really see just how human driven things are too. I mean, when you're saying that I really do get to see the length and breadth that humanity can run. But when it comes down to it, when people are like stressed out and panicking and they're at their, you know, the end of their life or fearing for their life, things like that, they are all at base still human. And so you don't have to change the way that you interact with people, you just have to be human as well. So I don't know, I think maybe I'm more human driven, but then I run a good call in the ambulance, or I feel like I made a difference at the end of the day medically, and I'm like, I'm definitely just in this for the medicine. But
you're like, fuck yeah, I just did that.
Yeah, it's definitely like a roller coaster of some days I'm all about like the medicine and really made a difference medically, and then some days you feel like you didn't do a single thing medical wise, but you held that person's hand when they really needed it, and that was more than any medicine could provide that day.
So I kind of want to I want to branch out like both ways. You know, what's a case where you're like, fuck yeah, I just fucking did that. I'm hot shit. Fucking bow to me. I did that. You know, I thought I didn't think I could do it. I wasn't sure about it, and I did it. And then on the other end of that, when was a time where you just really, you know, you didn't know you had the compassion you did for someone, and it just, you
learned something about yourself.
Yeah,
I guess. These are loaded questions.
Yeah, very loaded. We just dove right off the deep end. No, I love it. I'm all about it. I guess going like the kind of like human route first. I, as an EMT, I had a really hard time transitioning into the in-hospital nursing role because I was so concerned about, you know, what's going to kill my patient right now, what can I fix right now, and like do that and then be done. And so during orientation, I was told I need to be better at connecting with people because I'm okay on the medicine side. I'm okay like handling, like that's fine. But people need people, and they need that human aspect.
Sorry, go ahead.
No, it's cool. Would you consider yourself to be more of like a left brain kind of person, like a logic, mathematician kind of oriented?
Yeah.
All right.
Yeah, pretty much.
Yeah, so that makes sense.
That's a fair assessment.
Yeah.
Yeah, I was just going to ask you, so you were so used to, from firefighter EMT, such an acute care type of thing.
Right.
And now you had to transition to chronic.
Yeah.
And, you know, seeing these people for days, maybe even weeks on end, having to build a rapport with them, which is not something you were necessarily used to.
Yeah, and in the ICU that I work, we sometimes have patients that are waiting for organs, that are like on the heart transplant list.
Dang.
And so they're there for 300 plus days while they're waiting, like literally just waiting with the medical support that we give them to get a new heart. And so you can't come in the next day and be like, all right, you got everything handled? Great, bye.
So a year of their life, 300,
you got your heart, all right.
Yeah.
12 months, 365 days of waiting for a heart transplant, maybe longer. Kidney transplant, maybe longer.
Yep. Yeah. It's people can wait for extraordinary amounts of time, but if you think about it, someone who's waiting for a heart, right? You wait for a year, you wait for a year and a half. You now get however many more years that gives you.
Guess
And
it's
so it's a
bad, yeah.
chapter of someone's life, not just like, but they are living at the hospital, and to not create a rapport with your patients is essentially to miss out on nursing. So, so you were asking me to like bring up an example, like tell a story. So
Yeah.
I worked night shift before I flew here.
Okay.
And it was like fairly slow. And we have a room on our unit that is called the procedure room. It is essentially like a mini cath lab OR kind of. You
Okay.
can go in and do procedures, and then take the patient back to their room. And you don't have to go downstairs, upstairs. It's on our floor. And it was a fairly slow night, and our charge nurse happened to have been the one that precepted me. And around 3 a.m.
Can you, just for everyone listening, can you explain
Yeah.
these terms?
Sorry, right. Medicine can totally be another language. So charge nurse is kind of the one that decides who's going to be the nurse for what patient, who's going where, how the unit is going to run. And preceptor is like trainer. So she trained me. And that night in particular, she was in charge of like how kind of the nurses worked with the patients. So it was about 3 a.m. It was really quiet on the unit. And quiet is kind of a curse word in medicine. If you say it.
You use the word Q, right?
Yeah, the
Very
Q
Q
word.
on the floor.
Yeah, because if you
Seriously?
say... Yeah.
Yeah, you know, just sorry not to cut you off.
No,
but
do it.
I remember, you know, I'm a cardiology tech, and one of the cardiologists I saw on the floor as I was collecting EKGs, and I must have been a few months in at this point. And he's like, "Hey Ryan, how you doing?" I'm like, "Hey Dr. Lax, how's life?" We started shooting the shit a little bit, and he's like, "How are things downstairs?" And I was like, "Oh, it's really real quiet, nothing crazy." And he goes, "Oh," like he's like, "Don't say that." And I was like, he was cool about it though. He was just like, "Don't say that. We just,
Yeah.
because when we say quiet, something bad always happens. So
Wow.
just use the word
Yeah,
Q."
exactly.
So since then,
I had
no
idea.
quiets in the
I
in
was
the
not
hospital.
superstitious until I started running on the ambulance. And then the Q word and the full moon, man, they are real
Oh, yeah.
things,
Full
and they
moon-
affect...
Full moons are insane.
Yeah.
We'll get to that.
I've heard about that, but yeah, continue.
So it was pretty Q on the floor, and it's like 3 a.m. and she kind of walks by and she was like, "Does anyone want to go to the procedure room?" And I was like, "What?" Apparently this patient needed a procedure done, and the nurse on the other side was, really busy trying to get her stuff together, needed to sit down and chart, and it was like 3 a.m. and she was kind of kidding, and she kind of started to walk away, and I was like, "I'll go. My night's actually fairly calm. Yeah, I'll go into the procedure room." So you gown up, you have to put the lead on because there's an x-ray machine that's in there actively going on while they're doing the procedure. And this patient was just very anxious, could not stay calm, had a hard time breathing because of his condition. We didn't really want to give him too much sedation because if you do that, you also sedate the respiratory drive.
How old was this person? Age
40s,
range?
50s.
Okay.
So he was a full-grown adult, and we, he had a big breathing mask on, and we're trying not to sedate him too much, and he's incredibly anxious, and he's under the sterile drapes, and I'm on the side with the computer right here, his head's laying right in front of me, and I'm trying to push medication and talk to him, and my charge nurse opens the door probably about halfway through the procedure. We're doing okay. He's not freaking out yet. She opens the door and she goes, "Hey, how are things going in here?" And that was it. All hell broke loose. He starts flailing his arms, moving things. And when things are sterile and the doctors are working on, placing a line or getting things with central access, it's very important that things don't move because the big needle going into the neck or any of the other medical instruments could cause very real damage and harm to the patient. And so he's moving his arms and freaking out. The doctor's over here "What's going on?" I'm like, "Anna, I'll get back to you in a minute." And I was I kneeled down right by the patient. His face was level with mine. And I just said, "Look at me.
Oh,
Just
snap.
Look right here.
Yeah.
Look at me. We're okay. You've got the mask on. You're breathing. We're okay."
So you kind of gave him a slap in the face without hitting him in the face.
Yeah.
You just calmed me down a little bit.
Yeah, there was something about that. I was like,
I mean,
I can believe that.
it's, if you tell someone we're okay for a second, we're okay. And in the moment, he had what he needed. We were fixing the problem. It didn't mean everything in the hospital stay was going to be perfectly fine. It didn't mean that everything was going to be fixed. It just meant in that moment, we're okay.
So what caused him to freak out, though? Was it the question? Or was he, like, just becoming cognizant of his situation?
I just, anyone that's placed in the hospital in an ICU who's going through a procedure, there is a very high level of anxiety about that. I mean, when you bring someone's health into the question, I get nervous.
Yeah, there's even a thing called white coat syndrome. Once you step into the hospital, your blood pressure shoots up.
Oh, dude, I get that.
Yeah. It's a real phenomenon. Just because people know that they're in a hospital and they know that they're in there for a bad reason, even if they're normally just regularly calm. So I guess psychologically, somewhere back there, your body's trying to tell you something. Like it's almost like a hospital screams danger for your body's internal system.
They say that's why people get road rage too, because like in your mind you're like, I'm moving super fast in this car, like anything I do could result in an accident, and so that's why you lash out at people, because you're more tense driving.
Wow, I didn't know
They
that.
say that about the airplane too. Like you in the back of your mind, your body's just like, I'm thousands of feet up in the air right now.
This is not normal.
So that's why I don't feel comfortable.
Yeah,
Like,
I believe that 100%.
yeah, man, that's crazy. White coat syndrome, you call it?
Yeah, white coat syndrome.
Cool. Well, you definitely reacted in like properly. Like I felt the energy of you saying
Yeah,
that.
B minors.
Like, calm down.
It
That's
was
pretty cool.
That took me a little while to get the hang of.
Mhm.
Some people get the hang of it just like that without even thinking about it, but it's now become second nature, whereas I had to work on it really hard to get there.
Yeah, I find, not just with patients, but with just people in general, it's almost like if you don't feed into that energy that anxiety or that anger or whatever emotion they're feeling, if you don't feed into that, then it's that much harder for them to maintain. So at least when the hospital, I'm sure you have examples of this too, is when you have a patient that's super anxious, the most important thing is to just, I like to take a deep breath and like slow my breathing, and sometimes, not always, but sometimes, if not most of the time, I can get them to almost start breathing also, almost in sync with me, and it's strange, but it's worked for me.
Yeah.
And like suddenly they're calm, suddenly they're listening to me, suddenly they're doing what I ask, and maybe they're still a little stressed, but they're a little bit more at ease.
Breathing is one of those weird things, man. It's like hypnotism. Like I feel like you when you start like when you really go deep with your nose, man. Like think about just like breathing in for like 10 seconds, man. Then boom, like letting out a huge breath. Like your whole body and mind gets like.
Well, it slows your heart rate down. I think that's one of the biggest factors. It slows your heart rate down, and it's almost like it's less of a sensation of hyperventilation where. That's almost like a danger response. If you're breathing past 20 breaths per minute, then something's up. What is it? 12 to 20?
Mm-hmm.
12 to 20 breaths per minute is what's normal for people. If you exceed that, then there's a problem. If it's lower than that, then there's a problem.
Huh. This stuff is so interesting to me, man. I don't know. I love that kind of stuff.
Well, I mean, even, when you're talking about mimicking someone, we all went through resident assistant training, RA training. They talk to you all the time about de-escalation techniques. And when someone is angry, when they're yelling at you and you keep your voice down here, they can't keep going up. And so you have to bring them down.
That happened to me once. Her name was Alexis Rylander, and I'm not sure if either of you knew her, but we had this de-escalation training at that point. And I was the one trying to instigate, and she was the one trying to de-escalate.
I can't imagine you instigating, man.
Oh,
He's too friendly, dude.
I don't know.
I'm
He's
loud,
a troublemaker. You crowd.
Yeah, she knows too much.
Dragging on you.
I'm just loud, so I can get really loud, angry. At least play it off.
I can't imagine.
Oh no, I can definitely get angry.
Not in real life, but I could see you doing this for the role playing.
Put on an act.
Yeah.
Yeah. Well, ask my family to tell you a different story.
Oh.
But where was I at? Yeah. So I'm like trying to like yell at her. I'm trying to just stomp around and like just be like in a fit. And she was talking to me nicely and talking to me calmly and say, Ryan, it's okay. Tell me more about it. I feel both of you getting calm right now as I'm talking like this, because that's how I was getting. I was just like, you know what? I can't be angry right now. It was just like, it was unreal.
Yeah.
It was unreal.
So yeah, that's cool that, RAing, just like he said, like being resident assistant, that skill parlayed into what you're doing now as like a living. That's pretty interesting and cool that you had to learn that from your experiences.
Absolutely.
So that was an example of a compassionate memory that you really enjoyed, that you felt great about. Can you talk about the medicine side?
Oh gosh, there are. So I work on an ICU, right? So I've got like, and I've only been there about a year and a half now, and I have definite handfuls of things that have happened that I could draw upon. But when I first started, I was like, that kind of imposter syndrome like replays through your head, like I don't belong here, I don't deserve to be here, I don't know how to do this.
What do you mean by that? Imposter syndrome. Would you elaborate?
I guess just so, you know, the name of the hospital itself carries weight, right? Mayo Clinic, you hear it all the time, and like, who am I to walk into Mayo Clinic and do the things I'm doing there, right? I came from kind of smallish town Pennsylvania all the way away from Minnesota, and now I'm the one that gets to affect change in people's lives medically and personally. Like, it just feels like such a big deal to me that it's almost like I don't belong there, kind of like, and I'm an imposter, like.
It's definitely a big platform to be on.
Yeah, and any nurse anywhere is on that platform, right? Any medical provider anywhere is doing that. I'm sure you've probably felt it once or twice being on the ambulance or being a tech, is like, you in this moment are the one enacting change, whether it's calming someone down in that moment or providing like a medical intervention. Like, you are the one who is changing this person's life. Maybe not forever, maybe just in this moment, but it's a big deal. Like, it's definitely not a feeling that goes away ever, I don't think. But
yeah, I cut you off though. But
no, you're good.
To elaborate, yeah.
Okay, right. So we were I was still in orientation. So, funny enough, the nurse that was the charge nurse the other night, who was also my trainer, was there this night as well. So I'm still on training. I'm still with a fully trained in nurse who knows what she's doing. And we're towards the end of my training, and she says to me, Yanna, you still need to have a patient code. You still need to get a balloon pump, which is a cardiac device that's used in an ICU. And you still need to get like an emergent like cath lab transfer. So it's transferring a patient for a procedure in the cath lab and then bringing them back. So she's like, I really need you to see these things, and I need to know that you can do these things before I can sign off and say that you're done with orientation. So I was like, all right, sounds good. So we kind of start the night shift, and we're getting report, and as we're getting report on this patient, bam, he flips into VT, which is ventricular tachycardia. It's a lethal rhythm.
So is he having a heart attack? Or...
So...
I'm sorry, I jumped ahead.
No, you're totally fine. This is kind of one of those, like, pause moments again, because medical terminology is a completely different world. It's a common misconception that a heart attack stops your heart.
Okay.
That's a cardiac arrest, is when your heart stops. So I actually just explained this to my mom on the drive down to the train tonight. A cardiac arrest, you need CPR for.
Yeah.
That's where you're pumping on the chest, you're shocking the patient. A heart attack is kind of that, like, you know, you take aspirin to prevent it, your heart hurt, you got chest pain, you call 911, you're cool, you're pale, you're sweaty, you're getting rushed into the hospital, but you're still talking.
Right.
The heart attack is essentially, in short, defined as like a blockage of one of the three main blood vessels that feed the heart. So it's when you're not getting enough blood to your heart and your heart's getting damaged.
Right. It's kind of like gasping almost.
Yeah,
blood.
Your heart's like, man, I really need more oxygen right now. This hurts, it's struggling.
Once your heart doesn't get that oxygen, it starts to die. Like, the heart tissue just starts to die.
Yeah.
And that can lead to problems, because now the other parts of your heart have to compensate by contracting harder, making sure that your blood still, or your heart's still pumping at a acceptable capacity, something called ejection fraction, where it's your stroke volume, which is how much blood is going out into circulation with each pump, and there's cardiac output, which is based on how many heart rates you have, how much times your stroke volume. So it's like in a minute how much blood is circulating throughout your system. Okay. And it's 5 to 6 liters of blood throughout every minute of cardiac output. Is that true, or is that?
About it's like 4 to 8 liters per minute.
Okay.
But I mean, yeah, all of those things kind of are puzzle pieces to, even when the heart is hurt, you still need blood flow through your system, and so your heart has to compensate for that.
Okay.
And once cardiac tissue dies, it doesn't come back. It's like brain tissue. It's the only two things in the body that, when they die, your body doesn't just like fix it and bring it back.
Eesh.
Yeah.
Thanks for making that clarification. I didn't know.
It's tough because medicine is a completely different language.
No, I'll be the first to admit I don't know any of it. Obviously, Ryan knows a lot more than me. But
even she knows a lot more than I know. I mean, she has all these certs. She's seen she's seen worlds more than I have at this point.
And you probably know way more about anime and just worlds that I don't even know anything
just
about.
really important stuff. It's cool. One day you'll know that stuff too. But I'm sorry, I interrupt. So your patient jumps to VT.
Right.
What's going
so
on?
we're in
What's
the middle
happening?
of report, and bam, he flips into this lethal rhythm, and so we rush into the room. My preceptor, my trainer is on the monitor. We're the only unit in the hospital that has a monitor. It's a Zoll. It's a machine that can shock at the head of every bed. So it's like an AED. If you've ever heard of an AED, it's one of those things that you place on a person.
That's like the one in the movies and stuff.
Yep.
Just like, boom,
yeah, they
shock
open it up
by life.
and they say clear, like shocking. That's the device. Our unit has one at the head of every bed because that is how often we deal with this type of thing. So my preceptor is at the head of the bed. She hands me the pads. She goes, get these on. And she manipulates the machine. I throw the pads on. We have someone doing compressions because if you're in that rhythm, your heart isn't pumping effectively. So you need to do compressions to pump the heart. So we have someone doing compressions. I'm throwing pads on. She's working the machine. All the while, a code is being called. So when you hear like code blue kind of overhead, that's essentially what's going on. Someone comes in with the code cart, which carries all of the supplies that we need to effectively run that situation. We shock him, we continue compressions, and now I'm pushing meds. So I'm giving like epi and lidocaine and all of those medications that you hear kind of in the movies. And we get finished with that round, and we check for a pulse, and we have a pulse. So now that, like, we got him back. Now it's the cleanup, and that was what I was terrified for, because I've been on the ambulance for codes, I've run them in somebody's living room, you do that kind of thing, and it becomes muscle memory, and that I was fairly comfortable with, but the whole after part of it, that was completely new to me. So as a nurse, now we have to get him packaged up, send him to the cath lab to fix the vessel that was the problem. So as they're doing that, I'm getting all the IV bags strung. He's got like 15 different things. We intubated him, which means that we placed a tube down his airway so that he could breathe. He's now on a vent. We need to keep him sedated. We need to keep his heart beating. So he goes over to the cath lab. I have a minute or two to chart. I chart all my stuff, get kind of the room organized as much as I can, because no one cares about throwing trash away when you're in the middle of saving someone's life. So we kind of get all of that, and then we get a phone call, and they're like, yeah, they put a balloon pump in. I was like, great, now I have this massive cardiac device that I don't really know how to deal with because I'm still new in orientation. So I have to deal with that. I have to deal with the fact that he's intubated, like ventilated, sedated. I have to deal with his blood pressure. I have to deal with kind of keeping his heart beating and his blood pressure where it needs to be, and managing all of that as a new ICU nurse with someone kind of peering over my shoulder saying, you good? All right, cool. Was just completely overwhelming in the best way possible. I mean, I love working under stress. So we get him back in the room, and every 2 seconds it's like, we need a new one of these. We need to do this. We need to...
and this is you saying this stuff now.
Yep.
Awesome.
Yeah. So it was the transition from, okay, we got the code handled and under control. Now we need to keep him alive for the rest of the night. And that was, like, in the morning, I had all of the IV bags on one pole, all of the pumps lined up and together. He was on like 15 different things. All of his charting was clean. He was organized as much as possible. I mean, when you have cardiac monitors, respiratory monitors, all of your IVs, all of your lines, a tube for pretty much every orifice, it's not easy to have the patient organized. And by morning, someone walked by, and I'll never forget what she said to me. She looked in the room and goes, wow, looks like you must have had a calm night. And I was like,
Wow.
no, But to
Was that
have
sarcastic?
No, she was serious because of how like clean and organized he looked. She actually thought I had a calm night, and to me that was the biggest compliment. I was like, wow. By the time morning came around, someone who was literally like, we were fighting to keep this guy alive all night long, and for her to come in and think that we had a calm night meant that like we really got him together.
A testament in part to your ability to just, like you said, organize. You said under stress, organize under pressure, and just go with protocol and bang, bang, bang.
Yeah, and I mean, it's never a one-person thing. I definitely leaned on my my preceptor that whole time. I was like, hey, what do you think about doing this? And she's like, you're the nurse now. What do you think?
Isn't that crazy when people do that? Like, you've definitely been in situations like that.
Yeah,
where
yeah.
Like, you think this is cool. It's like, well, that's you now.
He's
Like,
he's
"Oh, that's
trying to
me."
let you fly.
Yeah.
Yeah.
So you were just flying that night. Right before she
Yeah.
said, like, I just want to make sure you're ready.
Yeah. And it was kind of the craziest thing was because she was like, you need to do this, this, and this before I'm comfortable letting you off orientation, and all of those things happened that night. And
It's a sign.
yeah. It was. I think it was her. It was even crazier because, short story, the night before, the unit was Q again, and she pranked me really hard. In one of the rooms that was empty, you have to check that machine that's at the head of the bed every night, the monitor, the Zoll, to make sure that it's functional because of how often we use it. And I was checking those machines, and she was like, hey, can you check room 58 in the corner there as well, please? And I was like, yeah, sure. So I'm like walking down that direction, and the lights are off, and the curtain's pulled. And I'm like, why is the curtain pulled? So I pull back the curtain, and there's a mannequin on the ground with fake blood, and someone's like snickering in the back. I didn't even hear her snickering in the back, and I was just like, oh my god, there's somebody down, like, in fake blood. And she laughed so hard. And like, it's just crazy to go from one night being so calm that you're like pranking someone like that to go to trying to fight to save someone's life the next day.
Is that the normal kind of culture at the Mayo? You know, you go one night of joking around, everything's easy.
She's like, I gotta be
and
careful
then
what I
another
say.
night, you know. I'm not saying it's a bad thing. I actually would prefer my nurses and my doctors with that have such a humor. You know, everyone
Yeah.
needs that.
Well, Patch
You
Adams.
know, that's not a bad thing.
Yeah, no, I think you definitely have to have a sense of humor to work in the medical profession, for sure. And it's not like any other job where, like, you never have a consistency in your patient population or how many patients you have or how crazy the night's always going to be. So there's definitely a roller coaster as far as, like, some nights it'll be, like, raining and pouring, and some nights it'll be, like, drought. But, yeah, it's kind of, I feel like it's medicine everywhere.
Yeah, definitely.
That's really crazy. That's just insane.
So, I mean, you got your education at Temple in one
Yeah.
of arguably the best cities to learn medicine.
Oh yeah, this city is a hotbed for medical personnel.
Yeah, how do you think that influenced you?
Pretty massively, I'd say. I'm one of the lucky nursing students who got to have my experiences in a ton of different hospitals. You know, if you go to school in the middle of cornfield country, you probably have your local hospital, and maybe if you're lucky, you go somewhere else for your, like, capstone project. But I had a combination of, like, Temple and Fox Chase Cancer Center and CHOP for pediatrics and a ton of, like, primary care offices and psych rotations, and I had a different hospital for every rotation. And that really empowered me to say, yeah, I can walk in anywhere and figure it out. And it didn't mean I knew what I was doing where I went. It just meant I've had to figure it out before, and so I can figure it out now.
It gave you that confidence.
Yeah, absolutely.
It's good to be versatile, like to acclimate to new environments. Are those like the equivalent of internships in what you were doing, or?
Not exactly. So, a rotation for medical students is you get placed in a particular specialty for a certain amount of time, whether it's 6 weeks or a month or a semester, and you know, go through learning about that specialty for the rotation.
Yeah.
So we had, like, OB and pediatrics and psych and critical care and kind of all those different specialties to just get a taste of each one and figure out how to be a nurse in each one of those situations.
That's cool. You didn't have to.
No,
That's not your type
kinesiology.
of thing.
Honestly, if I were to do it all again, I don't think I would have picked kines as a major. Temple, not to say it wasn't strong, but your only real track is physical therapy. And,
Right.
you know, mind you, that's what I was thinking about going in to begin with. So at the time it was good. But, you know, where I am at now, you know, I think the only thing that benefited me was that I took anatomy and physiology, and, you know, surprisingly, a lot of
great
science
class.
majors did not take that, which I don't understand. You know, you think that would be a requirement to take anatomy and phys, because I think that's such a staple to, you know, to science in general, especially human physiology. You know, how are you going to know that if you don't learn about it?
Yeah.
You know, I feel like most science majors are trying to go into medicine anyway. I mean, at your base, you could at least take, you know, mammalian anatomy phys, you know.
Yeah.
It might not be especially niche to people, but, you know, more or less, mammals have similar makeups.
Right. I remember seeing the anatomy book because my friend went through anatomy, and I was just like, dude, that's insane, man. That book it looks like if you dropped it out of a window, it could just knock somebody's head off.
You know, I'm not sure your experiences. I don't even know. I mean, you started learning about medicine when you were in high school. I personally didn't even. It's strange. My mom was a nurse, but I never even really paid that much attention until I was like end of sophomore year, beginning of junior year of college, and that's when I took anatomy and phys. And I mean, it was rough. It was rough at first. Like, I didn't know anything about chemistry. I didn't know anything about physics. I didn't know anything about biology. Yeah. And they all play in this big picture that is the human body.
Yeah, man.
People say there is no God.
So you believe in God?
Absolutely.
Okay, and you believe that because of the human body?
I wouldn't necessarily say that, but it's a huge piece of evidence for me.
Okay,
yeah.
Talk about that.
A lot of intricacies. I know exactly what you're saying.
Yeah,
in nature.
I mean, to think that every single atom has to be working in tandem for you to sit here and have this conversation with me. Your red blood cells have to be carrying enough oxygen to keep your brain perfused to make the neurons like transmit in their synapses to send a signal to your mouth to even open up and speak. Just blows my mind, and it's just wow.
Side note, you ever have moments like that? Like, I have moments like that.
Oh,
This is gonna sound super high, but like I was looking at my hands one day, and I completely agree with your point.
Wait, where are you going?
No, dude, I was looking at my hands one day, and I was like, yo, like I'm not really thinking about doing this. Like, I'm just doing it. And like scientifically, biologically, I am, right?
Yeah.
But I'm just not like, there's not like a command like on a computer like --:, move fingers, but like it is going on just unconsciously. And I was like, I'm in control of this. I had somebody on my podcast the other day, and he's just this like really experimental artist musician guy. He's like, we're just meat controllers, man. He's like, we're just all meat controllers, bro. He's like, this is just the controller. He's like, the players inside. He was giving an analogy, man, but like
Wow.
I just looked at that one day. I was like, yeah, does that ever hit you? Like, you ever just like,
that really hit me when I took organic chemistry. Because organic chemistry is all about how, you know, reactions occur, how molecules can change, how they change, whether they're like one step or two step. There's different types of reactions that can take place. A lot of acid base type of chemistry in the body, and that plays into, you know, organic chemistry is really your base in biochemistry. You know, the bio part is knowing about how the body works, knowing about enzymes and proteins, carbohydrates, all these other things that make up us.
Right.
And then there's the chemistry side where we understand the almost orgo about it, the inorganic chemistry also of how molecules interact with each other, because really at its basis, at a baser level, these enzymes are made up of molecules. Like, we're all just molecules together.
Right.
You know, and these enzymes are made up, our cells are made up of molecules all interacting with each other.
Yeah.
And outside the cells, there's an enzyme that is, you know, has its own kind of cellular biology about it.
Right.
And, you know, that's all run by chemistry and, you know, run by balance, run by these step 1, step 2, or this whole one-step action that causes all this to happen, and it's all run by energy.
Right.
It's all run by energy that's traded and transformed, and, you know, like, all this is going on in our bodies as I'm speaking these words.
Right.
You know, meanwhile, as I'm speaking these words, there's wavelengths coming out of my voice.
But see, what makes
and that's how you can hear it, and it's being transferred into your ear, and there's an auditory canal where we have certain muscles and certain bones that hit off in certain ways that, you know, going back, you know, that wavelength goes into your ear, it hits your nerve a certain way, the vestibular-coccular nerve, right? Is
Vestibulocochlear.
Yeah, and
Yo, see,
you know, like there's this nerve that hears this wavelength, and that causes a vibration, which then in turn turns into an action potential that travels through your nerve, and then it can cause a reaction from your hand.
And all of that has to be exactly fitting together like a puzzle piece that was made for the other piece,
And it really is.
like that's just.
but here's the even crazier part of this.
Let's do it. Go another level. Bring it.
Like 90% of people will live and die never understanding that. Like, you guys are special in the fact that, like, you have an education where, like, you understand that. Like, you can go through your whole life and not know how any of that works and be fine if you take care of your body.
I'll tell you what.
Like, that's the part that gets me. Like, when you go to sleep, like, you're never afraid of, like, I won't wake up unless you're, like, critically, like, about to die. But you do.
No, that's because, with knowledge comes overthinking. With overthinking, sometimes not always, but there are times where working as a cardiology technician, sometimes I'll have palpitations, and like I know it's normal. Everyone has palpitations sometimes. They're called PVCs, and like everyone gets them.
You can get them from caffeine. Just drinking caffeine can give you a heart palpitation.
And on the EKG, it comes up as a very, very wide complex.
Yeah.
Right, and like it's normal. But sometimes I feel it, and I'm thinking about all the things that can go wrong with my heart just because I know them. Yeah. Whereas if I didn't know that, I wouldn't think twice about it.
Right.
But to go back on what you're saying about some people never knowing, like you see that all the time in patient population. Mm-hmm. Some people know nothing about their body, know nothing about health.
I don't. I feel weird. Like, I have a working human heart. Obviously, I'm alive, I'm breathing, but I don't know how it works. Like, you just explained to me something I had no idea of. But, like, as a human, I feel like I'm endowed to, like, know at least.
But that's the beautiful thing about it, though, is and that's why I'm like, there has to be a God.
Yeah.
Because you don't have to know anything about it.
It's crazy.
You just work. Like, one of the facts that really gets me is when you talk about acids and bases, right? Mm-hmm. Our bloodstream has to have a very specific acid-base balance. It's between 7.35 and 7.45 that our blood has to be acidic or basic in order for us to survive. Our respiratory cycle can change that. How fast we're breathing, how slow we're breathing can change that acid-base level.
Yeah.
And if it's not exactly in there, you will die.
It's a wrap.
And, like, you didn't even have to know that, and you're still breathing and you're still living. And it's just, breathing gets me too, is because you can think about that and you can control that. But when you go to sleep at night, you don't have to worry that you're going to stop breathing in the middle of the night.
I've said this before a million times. Everyone's afraid to die, but no one's afraid to go to sleep, and that messes with me so hardcore, so hardcore. But I 100% agree with you.
But yeah, like people just don't know sometimes. Like I had this lawyer who was getting a stress test, and stress test just make sure that your heart's performing correctly. There's nothing, just call it ischemia. It means that there's not enough blood getting to your heart. Like those 3 vessels she was talking about, sometimes they're blocked and not enough oxygen is getting to that area, causes tissue to die. Like she said, tissue doesn't grow back, doesn't heal, and then you have a problem. So I'm looking at his EKG. Big time lawyer, has so much money, has done everything. He's telling me all these stories, and I'm trying to explain to him his EKG because he looked concerned. I was like, oh, it looks fine, normal, called normal sinus rhythm. It looks perfect. And I was trying to explain it to him at a more deep level, and he was just like, "That's fine, dude. I don't. That's your job. I don't get that." Like he just like had no interest whatsoever.
Really?
He's like, "I trust you," and I'm like, "Damn, like that felt good." Like,
that part feels good.
It's nice. Yeah. It's nice when people trust you. Like some people call me sir. Like there's a respect that you get from taking care of someone.
You don't always get in the medical world.
Oh, you don't always get it, but when you get it, it's real. When you get it, it's real.
It's one of those like, whoa, that just hit. Like
people disrespecting you openly.
Yeah, I have in the past.
Dang.
Yeah. You don't have to go into specifics, but can you talk a little bit about situations?
I mean, even working here in the city probably has the most examples, but Narcan is a medication that's kind of on the rise. It's kind of a hot buzzword. It's a medication that you give that essentially reverses an overdose.
So, real quick, I was reading about the Narcan, and does it just basically heroin attaches to these receptors that causes it to work, and Narcan just blocks these receptors? Right.
So if you think of like a receptor kind of being a hole and heroin fitting into that socket, it's an opioid. Any opioid can fit into that socket there. What Narcan does is it's a competitive inhibitor. So what it does is it competes with the opioid. It gets in between that receptor and says, nah, we're just going to knock the heroin off right now. And will attach to that receptor, and then you no longer have the effects of the heroin being attached to that receptor.
So it just fits more perfectly than the heroin?
Yes.
Okay.
Interesting.
But it only lasts for a little while. So it's really popular now because you can essentially bring someone back from overdose.
Wow.
But you have to get to a hospital after delivering Narcan because it doesn't last forever. So we're in the city. We have a very clear overdose. He's laying, not breathing that much. We're breathing for him in the moment. We administer a dose of Narcan, and he kind of groggily sits up and starts throwing every curse word in the book out at me. He's like, why the hell did you take me out? I just wanted to do my thing. He was like, I wasn't even doing drugs. And I was like, interesting, because then Narcan wouldn't have worked on you. But and you just get called every word in the book, but you go home that night knowing that what you did made a difference. And so it sucks and it's tough and you get beat on all the time. That's why there's a really, really quick turnover for a large majority of EMS providers. You get burnt out and you get exhausted, and it's tough to kind of deal with that population day in and day out.
And people that are given Narcan for overdoses, they're generally combative, right? They're usually aggressive when they come out, or is that
I would say it's like a 50-50.
50-50.
So the big myth about Narcan is that they're going to sit bolt up and they're going to projectile vomit and then they're going to start swinging. And that does happen, don't get me wrong. I've seen it before.
So aggression is part of Narcan? But you're saying it's part of the myth.
It's part of the myth,
okay.
Right? So when you take someone out of their high, they're going to be pissed off that they're no longer high.
Because it's such a drastic,
yeah.
cut off.
You're essentially pulling the heroin off of the receptors and bringing them out of that high. And so people can get pissed off, absolutely. And then they can get aggressive and they can get nauseous, and that's kind of the stereotypical picture. It's not always like that. I have had some people say wow, I'm really glad that was a little farther than I meant to go tonight, kind of thing. And definitely not in those words exactly.
It's pretty casual.
Yeah.
Oh man, I was almost at death's door.
I'll try again next time.
Yeah. Yeah, but I have had people say see you again next week kind of thing.
Whoa.
And it's dude.
Yeah.
See, those people need then that's where the psychology stuff comes into. It's you should go seek help.
Right. So Narcan is definitely a step in kind of combating this opioid epidemic. I think it's absolutely a needed thing that we've been waiting for it for a while to help. But it's definitely not the end-all be-all. It is the Band-Aid to the bullet wound on that one.
Yeah, I mean, we're getting back into this whole opioid epidemic, and you've seen it firsthand. I've had actually a situation personally where I had to deal with it firsthand, and it's rough. It's really
scary.
rough. And my question to you is, since you've seen it more than once, I'm sure, and do you think that it is a disease, or do you think it's because I've heard two ends of the spectrum. I think especially healthcare providers handle it on one end or the other. There's no in between. It's either it's a disease or this person chose this.
See, here I'm gonna burst your bubble, because I don't think that it's stone cold either.
Really? No, tell me. What do you think it is?
Yeah, so I think
just to clarify before we jump into that,
go for it.
Because I'm a little lost. Are you talking about addiction as a whole, or the opioid thing? So
from my understanding, from just people I've talked to in the healthcare field, just from in general, it seems to be there's a conversation of this opioid epidemic, either a choice that the person made and why can't they just quit, or not why can't they just quit, but why can't they choose not to use the drug? Yes, or it's a disease in that it's these people are sick and they can't get off of this because they are sick. They need psychological attention because it's a much bigger problem than they themselves can handle. Okay. And she is saying that she does not agree that it's so cut and dry, and I would love to hear about
me too.
Yeah, I don't think it's necessarily either. So I think it starts off as a choice. You choose to pick up the bottle. You choose to go out with your friends and shoot up that night. You choose to, and maybe it's not so much of a hey, what do you want to do tonight? Let's choose to go do this. It very well may be a socioeconomically driven choice, right? I don't have the money to do this. I'm going to go out with these people. These are the people I've grown up with, or this is what I choose to do to support my family, or the people that you're around. I'm not saying it's an easy choice by any means, but I think that first few times it is a choice. And once you start getting embedded into the addiction, that is where I believe it becomes a disease. And the reason that I kind of feel that way is number one, if you talk about alcohol, those that are in like really deep alcohol addiction can go through like a handle a day. And if you are that intoxicated, you need to go to a hospital to withdraw, because alcohol withdrawal will kill you. It will. A lot of other medications that you overdose on, the overdose itself will kill you, but if you're withdrawing from that, it may not kill you. Alcohol will kill you.
Wow.
You need to get medications to mitigate the effects of that withdrawal. And so that's kind of a big reason that I feel like alcohol addiction specifically, I mean, it needs to be medically managed. But addiction as a whole, yes, they made a choice in the first place, but we have receptors in our brains that react to things. The most common example I could use is nicotine. You have a receptor in your brain specifically for nicotine type drugs. It's the same way with pretty much every other one. That's why there's an opioid receptor that we can use Narcan to compete with heroin, with opioids. And when you're talking about that chemical reaction that's going on within the body, within the system, that is driving someone to say, like, I need a fix, it is no longer like a mental, I'm sitting here, I can make a choice decision. It is the shakes and the sweats and the nausea and the vomiting and the hallucinations and all of those chemicals wreaking havoc within your system. And for someone who may or may not have ever experienced that to come in and say, nah, you don't have a disease, you can just make a choice that day, I don't think that that's necessarily fair to the person who's going through it.
But people do it. People do it all the time.
Oh, absolutely. I have had a lot of people that are in the medical world straight up say, like, nah, they're making a choice. They just need to pull themselves up by the bootstraps, suck it up, and deal with it and stop using.
Do you think that's a hate for the heroin user or more of a way to cope with it?
I wish I knew. I wish that I could say what the motives are behind what people say.
I think it's fair to, your assessment is very fair to say. I mean, obviously addiction in the beginning is a choice, but once your body builds a dependency on it, like, it's kind of progressed into something completely different. You know, like addiction, like, I feel like addiction may start off as more of like a mental thing, but like you said with the shakes and stuff, like, that's obviously biological, very like violently demonstrating itself, like the need that you have and what will happen if you don't get it, like alcohol withdrawal, which is, you know, that's a condition right there.
You can go into full-on seizures and straight up die.
That's crazy.
Because you're in withdrawal. And that is terrifying to me. To see your system react so physically to a lack of something, it's just, scary.
So I've, in the past month, I think, I read an article about Philadelphia opening a heroin clinic, and so as a way of, I think they have them in Portugal and Sweden, you know,
they're in
other countries have these systems where, you know, a drug user can come and it's
a safe spot for injecting.
They can safely inject their drug, and then they have support if they need it should they overdose. Is there anything more to that? I mean, is there a tapering program in that, or is it just so they can cleanly shoot up?
I honestly kind of wish that I knew a little bit more about it. I think the big drive with that is that you're trying to prevent deaths, right? Because if someone overdoses underneath a bridge, no one's there to say, oh yeah, he's gone a little bit too far, let's go get him help. Right? If you're in this clinical, like, safe space, there's someone there who will know if you're not breathing. And I think from that aspect, you're going to prevent deaths. No doubt about it. But I think from a legal and mitigation of drug use as an epidemic, that part I'm concerned about. And I would need to understand a little bit more about how it works. I do know that Philly does have a needle exchange program already that is effective and has been effective for a while, where users can come in and give old needles and then receive new ones, fresh, never used, sterile ones. And that has done a lot for the city as far as preventing infection and the spread of disease. And through that clinic, they can also get training on Narcan and use Narcan. Oh, wow. And so that, I think, has done a lot. It's called Prevention Point. It's done a lot to, as the name suggests, prevent.
Wow.
And is that exclusive to Philly?
I don't believe so. I think there are a couple kind of spread throughout the country, mostly on the West Coast and the East Coast. I don't know how many there are in the kind of middle of the country. I do know it is not a common thing.
I mean, it's very controversial.
Absolutely.
Definitely.
Yeah.
I think it would make sense if they had these places where people could, like they were saying, they're coming in, they have a safe space, quote unquote, to shoot up. I mean, I would love to see a program like that have also tapering programs where they could slowly wean you off the drugs, which heroin's a very addicting substance, and I don't know how effective that will be personally. I don't have the research in front of me, but it's definitely something to consider.
Yeah, I think that'd be a great aspect to roll into it.
Definitely, like some sort of rehabilitation to put into that, because I understand the whole reason for it being there, and I could see the ethical dilemma. I'd have to second you on that. I don't know enough about it per se to speak on it, but yeah, I feel like some sort of rehabilitation potential plan would probably be really important to implement into something like that. That's really interesting. I had no idea that existed at all until just now. Huh. Yeah, but I don't know. I haven't done any drugs. Any crazy drugs.
You're clean.
Clean.
The transition there.
Yeah.
That's really interesting, though. The effect that stuff has on not only your body, but your brain. And just the many, like you said, the many ways that it can get into your hands. The socioeconomic ways that we don't even count. We don't even think about on a day-to-day basis. It's different for everybody, and a lot of people are in situations that we don't understand, so it's hard to speak on it.
So, to switch gears a little bit, we haven't really delved into your aspirations to be a flight medic yet, and like where are you in that journey right now?
Sure. So flight nurse, kind of the.
Sorry, flight nurse. Excuse me. Yeah, I saw you give me a look. I used the terminology wrong.
It's okay. It happens all the time. It's really, it's not an insult. It's just kind of you don't know. So, kind of the typical path to like get there. There's no set in stone. You have to do this, 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 and this. But typically, flight agencies like to see between 3 to 5 years of experience in either an ICU or an emergency department. And the reason for that is that, like I said before, the configuration is usually a nurse and a medic. And the medic is usually seen as the on-scene 911 kind of airway expert of there's an emergency, we need to fly to it, we need to package the patient up and send them. And then the nurse is seen as the critical care expert. And kind of what that means is that there's a piece of flight that is transporting someone from a smaller hospital, smaller institution, to a bigger, more resource-heavy institution that can provide the care in an ICU.
More comprehensive.
Yes, exactly. And so that's why they complement each other so nicely with the medic and the nurse kind of there. But what I would like to do is kind of attack that from both sides. So I've put in a whole bunch of years as an EMT. I plan to still do that. I absolutely love it. And right now I'm planting my feet and getting my experience on the ICU side, so that I can bring both of those, that critical care, that emergency experience to the table when I start applying. And so that 3 to 5 years of experience in your field, like as a nurse, I need to have like that solidified before I can kind of start applying places. But one of the cool things that I got the chance to do was be a part of ECHO, which is the East Coast Helicopter Operations. They host a conference every year. And they have this really amazing program called the Future Flight Program. And the Future Flight crew is a selected group of applicants that are trying to break into the flight organization, because as it's true in any organization, sometimes it's about who you know and how to get in.
Oh, yeah.
And this team, ECHO, is fighting tooth and nail to prove that wrong and to give people the opportunity to get places and to get the experience and the connections that you need to make it. And so this year I was honored enough to be selected as one of the future flight crew members. I was put.
Congratulations.
Thank you. Yeah, it was really cool. It was a great experience. They put us through a whole bunch of pre-conference work. So we had like papers and projects and just kind of build up to the conference, where we really took a look through our resumes, through our personal mission statements, kind of really just fortified our ability to connect with people at the conference. And then we got to go through the whole conference. So they had us in all of the lectures and the hands-on and the experience of the conference that just helped us make connections with flight crews all over the country, learn that critical care, that emergency medicine, really down nitty gritty, down and dirty information that you need to do the job. And then we got to leave with all of these connections that we still stay in contact with and are helping us to make sure that we get where we want to go. And so that was super, super instrumental in my path so far. I've gotten the chance to connect with a whole bunch of organizations that I didn't even know were on my radar until that conference. And it was actually in Philly this past year, which was super, super cool. So I got to kind of come home for a little bit. People are like, oh, wait, why are you coming from Minnesota? I'm like, no, you don't get it. This was my city.
So this whole experience sounds like it's really positive affirmation. Like, after this, you definitely want to do it. You
yeah.
know?
Oh, 100%. I think everything that I've had the opportunity to experience has just solidified what I want to do. I used to joke that I have a 50-year plan and I'm 2 years in. Now I have a 50-year plan and I'm 6 years in.
Hey, that's what I'm talking about. So on the topic of that, when you're a nurse and you're up in this helicopter, you personally, do you have to know any basic knowledge on how to work the helicopter just in case? Or how far the extent of that knowledge are you required to have?
So that's a little bit challenging for me to speak on because I'm not in it, but I have experienced a few fly-alongs, which is where they allow you to go with the crew for a day. And you definitely have to know safety information. You have to know kind of what to do if the helicopter does go down. All of the medical teams are usually trained in night vision goggles, so night vision navigation. You need to know about how the altitude's going to affect not only your medical care, but flying and atmospheric pressure and things like that as well. And then just kind of basics of really more safety driven than operational knowledge about the aircraft. Yeah.
Okay, cool. That's really interesting.
Yeah. So people are like, oh, that's really cool. You want to be a flight nurse? You're going to fly the helicopter? And I'm like, no,
of course not.
Please, no. I don't want to do that.
That's a huge task.
Yeah.
Okay, good, because that was like a question I had too.
So is the medic flying then? Or is it just a third party?
There's a pilot, yep.
Okay.
And the pilot, the kind of cool thing about the pilot is he or she is usually kind of shielded from all the medical things because you don't really want that to influence the pilot's decision, right? And so when a crew gets notified that there's a call, you don't find out what the call is until the pilot accepts the call. So the pilot, once they get notified, they're like, hey, I don't know, Mayo 1, we got a flight for you coming out of XYZ location.
Right.
Pilot says, okay, let me take a look at the air weather patterns, and again, that's way more advanced than I'm at that level. I don't know exactly what they're looking at. They make the decision, they say, okay, we'll accept the flight. And the kind of big safety thing about that is that if any one person is uncomfortable, then you pass on the flight. So the saying is 3 to go, 1 to say no. Because if even one person is like, I don't know, man, the weather is really questionable today, I don't really want to go on this, I don't feel safe, you don't take the helicopter out because it is that dangerous.
There needs to be 3 people on this team. Is that what you're saying?
Yeah, 3 people that say yes. Like, everyone has to say, agreed, we'll take the call, we'll go fly, we feel comfortable flying.
Does that ever cause any problems? Or?
You know, I don't think that it's like a hard and fast rule for every company. It's definitely a culture of safety that I've heard in organizations that I admire. So when I went to this conference, the ones that really had their stuff together told me, this is how it is. We all have to feel comfortable and safe doing our job, or else we're not going to do it.
Right.
Which I really, really respect in flight organizations. But as soon as you say, yes, we're taking the call, then they say, all right, it's a 4-year-old with a femur fracture, or it's a car accident on I-76, and then you go and you deal with it. But it's never like, we need you right now because this person is dying, like, fly the helicopter and then go crash it and get hurt yourself.
They don't want the case influencing your decisions.
Exactly. Because if you don't get there, you're not helpful anyway. So
the pilot basically just knows that he needs to go somewhere fast. The details aren't, I mean, eventually he's going to see what's going on, but, like, the details are kept from him intentionally, actually.
Right, yeah.
To make sure that he just,
for the most part,
she just goes.
Yeah.
Wow, this is such a crazy experience. And I'm not sure if it would be insensitive to, like, wear a GoPro on your helmet or something like that.
So, unfortunately, you definitely couldn't because of HIPAA, so the Privacy Act. It's kind of why, anytime you hear anybody tell a medical story, they never use names. We never use, like, very, very specific information because it's illegal.
Okay.
I can't tell you about a person that I took care of. I can tell you kind of like generally speaking, this has happened to me before. Like this is kind of the story of what went on. But you're never allowed to disclose any personal information.
Understandable, for sure.
Yeah.
I don't know. I do TV for a living, so that's like automatically where my mind went.
Yeah.
It's just...
Well, there are like documentaries and things like that where you can see kind of flight organizations in action.
Yeah.
Like what? Can you name one?
Oh gosh. So I want to, like, my immediate thought is there's one, I think it's what's it called? Night Shift or something like that out of New Orleans. That's like that one's on the ambulance though. It's not.
I know one to kind of swoop in here. NHK did something. They're the Japanese public television, and they air here. It's actually kind of popular to watch. It's dubbed in English, and it's called, I think it's True Professionals, and it's a whole like Japanese flight medic,
Cool.
his like routine and stuff like that, and yeah, his like credo and why he does it. So like, but it's like an episode of a show. So it's like a 30-minute thing.
Oh, I see. So it's not the whole show. It's just this one episode.
Yeah. I mentioned you to my dad, and he's like, oh, I just watched this thing on Japanese flight medic. So
That's really cool. Yeah, I don't know if there's like series that are like specifically centered on that, but I do know that I've seen like a couple of episodes of shows, and there's a lot that have like EMS as the center of, so like ambulances and police officers, kind of like cops but for EMS. That get to show the behind the scenes.
I'm afraid of asking dumb questions.
No, please. That's how you learn stuff. And we say that to anybody in medicine. Like, it's a question about, like, you and your life and how medicine works, and it's not dumb questions.
Would you ever have to, like, would there ever be a situation where someone had to, like, rappel down from the helicopter? Probably not.
For like, general, like, hospital-to-hospital transfers, probably not. But, I mean, you saw the coverage for Hurricane Harvey and just all of that kind of mess, and that definitely came in handy. I mean, the Coast Guard did hundreds of rescues on both of those hurricanes when they hit, and yeah, I would love to be a part of that too. I mean, gosh.
I guess the scenario in my mind is like you're responding to, I don't know, like a hunting accident in the woods, and there's this dude who like accidentally shot himself with a gun, and he called, you know what I'm saying, and like, but that's probably wouldn't be a helicopter that you send to get him, but like it's so far out in like the wilderness that it'd probably take a while for like a vehicle to get there, and there's trees, so you can't land the helicopter. I don't know.
Totally get what you're saying, and actually, I was a part of a call kind of similar to that. Like, it was out in the middle of nowhere, and we did have to go out there with like a 4-wheel type vehicle.
Oh, cool. You're
go
quadding
get
up
him,
with this guy?
and then like get back out to an area where the helicopter could land.
Okay.
So we would definitely be sending in some type of all-terrain vehicle or something to go retrieve the person.
Yeah.
And I mean, that's where wilderness medicine comes in, right? Is you need to be able to make a patient transport thing from whatever you got. So if you don't have a vehicle, you may have to carry that person, you know. But that is the risk that you take when you go out in the middle of nowhere to kind of do something.
How many driving certs do you have? I mean, I'm assuming you have your EVOC.
Yep. So I have my emergency vehicle operators course. I think that's actually only driving certification that I have.
Well, we were talking about, you know, all different kinds of transports, so.
Yeah. I mean, I think driving, that's it. But yeah.
That's cool. I mean, there's probably so many like tests and just like quiz. I'm not sure how it goes, like quizzes, but like courses that you have to take to get certifications and stuff. And you've probably done so many in your life so far.
I mean, it definitely takes a lot, and it's a common misconception that kind of like once you're a nurse, that's it, or once you're an EMT, like that's it. You know, you can kind of do whatever from there. I like to say sometimes like you're working to get the letters of the alphabet behind your name because there's so many different certifications. But the truth of the matter is that like I study that information not because I'm trying to pass a test, but because it's going to come in handy when I'm trying to save someone's life.
Right.
And I need to be able to know that information and put it to use because I'm not going to put a piece of paper to use. I'm going to put that information to use.
Yeah, you're not holding up that cert to the patient who you know, just almost died, who you failed to help, and someone had to intervene, you know, saying, well, I have this.
But I am certified, I swear.
Yeah, don't you get it? Like, I passed the test, I paid all this money to get this cert.
Right.
I'm competent.
Right.
Yeah.
I feel like that knowledge is inherently easier to retain because it's like instantly applicable. So like when you're learning something practical, like you remember, you know, because you're just like, yeah, this is gonna have to be that way, as opposed to like learning something theoretical and stuff like that. So when you're probably in those courses, you're probably like really locked in.
And like that's the tough thing too is there's both theoretical information and practical information, and so you like lecture in the morning and then hands-on in the afternoon or whatever, and then you don't use it for weeks because it's like a high acuity, low happening type of event.
Do you prefer the theory or the practice?
Oh, that's impossible because you have to have both. If I don't have the back information on it, I'm not going to understand why I'm doing it. And for me to be able to do it and remember how to do it, I need to understand why I'm doing it. So, I don't know.
They're intertwined.
Yeah, they are intertwined.
Okay.
Yeah.
There's different people.
When you're... Sorry.
No.
I was going to say, when you're first learning something,
yeah,
especially something medically related, are you focusing on the theory first? Because like you said, you need to know why you're doing it?
Yeah. I think it depends on the situation, right? I've had times where I am on orientation or I'm with a nurse and I'm like, hey, I really don't know how to do this. I'm setting up continuous dialysis or like figuring out how to string a line up and put this medication like into a person. In that moment, I'm like, I just need to know how to do it right now. We'll go back and look at it later because it's kind of like a high stress, like you need to kind of get that thing done. But then I'll go back and I'll look at the theory behind it and like, why are we doing this and how are we doing it? But I think when I'm first starting something and I'm like getting into it for the first time, I definitely like that theory first. And I guess that's kind of maybe biased in how I was educated, right? Because anybody who's in any kind of medical education, you start off in lectures and then you go to your rotations.
Right.
And you like progress to that, and it's kind of like, yeah, I've gotten this far, so I do get to do the hands-on piece now.
Yeah.
But I'm also a bit of a nerd, and I kind of like highlighting and studying. So.
Well, introductions in academia are usually broad, right? The concept overall is presented first, and then it gets down to the nitty-gritty.
Yeah.
I mean, that's how a lot, like math is and all sorts of stuff that are kind of like that. My bad. What were you about to say?
I don't even remember.
Oh, dang.
It's cool because you start broad and then you kind of find your niche.
Yeah.
Which for you it sounds like you start out with EMT, you went to be a nurse, and now you find your niche of, okay, I need to get these broad strokes and work my way up to this flight nurse.
Yeah.
And speaking of niche and finding your way, you said 50-year plan. I'm not sure if you were joking about that. What is like the ultimate progression for you? What are you ultimately trying to reach? Like this nursing thing, like this flight nurse thing that you've been describing this whole podcast. Like, what is the ultimate goal here? What's the big plan?
Yeah, I think so. The big plan for me currently, I guess in this phase of it this is the plant my feet phase. This is get into it, get your information, get your foundation beneath your feet, like know what you're doing. Because if I don't have the base knowledge that I can rely on, I'm not going to know how to do anything on the helicopter. So kind of this phase is like really just get my stuff together and figure it out. And then I want to start applying for flight programs. And I think maybe before I accept a flight program, I might work in an emergency department or take a change of pace there. But I guess the next, and this whole plan is fluid. There's like, I can do this or I can jump right into flight. So I guess applying for flight is kind of the next phase, and I'll be working while I apply for that. And then I do want to fly for a few years, get a good solid chunk of time in there flying. And then I kind of probably want to go back to the bedside. I really like it on the ICU. I think as a nurse I have a lot of autonomy. I have the ability to affect change minutely and on a big, large scale. And if I decide that I don't want to go back to the bedside, I think I might go back to school. So I love teaching. I'm an EMT instructor. I was a CPR instructor for a while. I really love kind of seeing that light bulb click in someone and letting them do something and seeing them get it. And so I think eventually I may go back to school to become an instructor for a nursing course or an EMT course or what have you. So
that's like the ultimate. It's like you just described it, to live out all the course of experience and then pour back into the once you know what I'm saying, the young you. And you definitely have that cadence about you. You speak eloquently and like very informative. So I could totally see you being like a teacher in the future and just laying this out for people. You should write a book after that too.
I mean that's all career like trajectory, I guess.
Well, you seem very career oriented, and at least autobiographies I've read, it always seems like the people who make it to the top, if they really make it to the top and they're really about what they do, they always want to give back by teaching or giving in some way. And I mean, guess yours would be teaching, you learning all you can throughout your career for the sole purpose of giving it back once you're done.
Yeah, and I mean, career-wise, that's totally the dream. But like I said, it is completely fluid, and that didn't really take into account any of like my personal aspirations of, I definitely do want to have a family, and I definitely do want to at some point kind of settle down, maybe where my flight organization is, where I decide to plant my feet, and that's definitely in the hopes as well. But we'll see what God's got planned for me. So
True that. I was gonna ask you, when you're not helping to save people's lives, like, what do you do for fun? I feel like you're somebody who'd really be into like fitness and stuff like that.
Unfortunately, I'm not. I do not do very well going to the gym. I will go and run and do the whole, cardio thing. But my workout used to be going to the firehouse on Monday night trainings, throwing on 50 pounds of gear and
hitting the stairs.
Exactly, like hitting the stairs or dragging dummies or doing whatever the training was that night.
That's so good for your body. They say like running hills is really good for your body, but like also doing that, it's just like great for your lungs.
It's practical exercise.
Yes, it has a point. That's why I can't gym very well.
Yeah, so I mean, I'm a big gym goer at this point, and it's because I have things that I want to get better at. It's not I'm not working out for the sake of working out. I'm working out to get my deadlift better.
So not
working out. It's almost practical in a way for me because I'm practicing the lift. That it's become fun to practice that lift. But people that go to the Planet Fitness or whatever just for the sake of staying in shape, that there's a lot of burnout to that. I think there's a reason, at least for me, when I was running track, back in like middle school, but I hated it. I hated it because it was just me and my thoughts running on a treadmill or on a track.
High school angst thoughts too.
Oh, you don't even give me. Let's not even get into that. But let's not even go there.
Scars, bro.
But it just got boring. Whereas if you're playing a sport or getting ready to go to that fire or doing focusing on a skill like a certain lift, then you kind of get lost in it, and then that exercise becomes a lot easier.
Yeah, so you put yourself in a mental place of the practicality, like you're talking about, like, all right, smoke everywhere, you know what I'm saying? Like, I'm hearing people screaming.
Way more motivated with like an activity or purpose.
Yeah.
I feel like that kind of goes into, there's this thing, people call it flow, workflow of, they say people who master things, it's like they just get so lost in what they're doing that they almost like tune out for a bit and it becomes automatic. And
Bruce Lee talked about
and there's
that.
almost, I forget where I read this, but they were explaining flow in that it's just like this feeling of just like, this feeling of bliss, this feeling of comfort, like you're in your space, you know what you're doing, you're just
like
in
muscle
the zone.
memory, you don't even have to think about it
You're
anymore.
just in the zone,
I think they mentioned that in this book called not Art of War, but War of Art, where it talks about when you're working on your craft. That flow is like, I think, a term that was derived from that book.
Yeah,
but
and
continue.
they talk about the masters of everything. Like they just get this certain flow, and it seems to be common throughout all professions. Do you feel like you ever get that? And do you feel?
Absolutely.
What does it feel like for you?
I guess the best way I can describe it is I have one of my partners on the ambulance at Chatfield. He and I get along great. His name's Dave. And when we get to a call in the ambulance, like on the way to the call, we're like, all right, great, you're good taking vitals, I'll take history, you get this, I'll get that, perfect. We get there and it just runs like butter melting in a pan, man. We know exactly who's doing what, where, when. We got everything figured out. He'll look at me and be like, hey, did you? And I'm like, yep, I already got it.
Nice.
And it's just one of those like completely, and it could, this person's having the worst day of their life, they're having chest pain, we're trying to figure out if they're having a heart attack or not, and things just, it sounds cliche, it just flows, like it just
hey,
goes.
that's the word. That's the word.
No, that's cool.
Yeah.
That's definitely, you definitely get an excitement when that, when that's coming into play.
You almost say like a euphoria? Do you feel just like,
It totally feeds into this adrenaline junkie lifestyle of like, you get done with the call, you close the ambulance doors after having like cleaned up the whole bay, and you just look at your partner and you're like, we just did, that was great.
Yeah, we killed it.
So you get hyped up as opposed to taking a breath. Is that your
I
experience?
would say so, yeah.
Okay.
And I mean, it's not like that on every single call, and even when calls go poorly, with expected outcomes or things go wrong every single time that you do anything, right? We're all human, we all make mistakes. But at the end of the call, it's just like, even if it really went badly, you're just like, wow, we really did the best we could, and we tried, and, you know?
Yeah, you got to learn to live with that too.
Yeah.
Which is, that's big. That's a lesson that I guess sometimes is hard to learn.
It's especially in this profession. I mean, not many people deal with death as often as those in the medical world do.
Yeah.
Especially on an ambulance or in an ICU. And I guess the takeaway from it is that you were there because you wanted to help, and you were trying to do something that probably wouldn't have happened if you weren't there. And so you have to take that home at the end of the day and say, like, you did what you could.
Right.
So.
Has there ever been moments where you just couldn't, and it followed you a little bit, and how did you handle
absolutely.
that?
Dave, one of the guys that I run with at the ambulance corps, one of his kind of sayings that I've adopted is, you don't get to choose the calls that haunt you. There are ones that have gone catastrophically, disastrously wrong, that I think about every once in a while when I'm like trying to think of things that I could do better, or I'm like specifically trying to recall. And then there are ones that didn't even go that horribly wrong that just stick in my head, and you see those people's eyes and the expression on their face over and over again, and you don't get to choose it, but everyone has their own way of dealing with it. I do well when I talk with people, especially like medical people that kind of understand what's going on. It's kind of tough to explain things to someone when you have to stop every 2 seconds and be like, wait, what is that again? How does that work? And it's a completely valid thing, because it's a completely different language and world. But I am kind of weird because I kind of just pour that right back into going at it harder again. So I like just try to take the lessons learned and take it into my next. I also write a lot, and I play guitar. And
What do you write?
Just journaling.
Okay.
Just writing.
But you use that as motivation, is what you said. Like, you don't let it deter you or make you misstep, even though sometimes it can. You just, like, you take that momentum and, like, that energy from what just happened, and you're like, all right, I'm going to capitalize on this next opportunity. Like,
Exactly.
no matter, regardless of the outcome.
I think writing's a great way to get it out too. It's got to stay with you a little bit, but just getting it out in words.
See, that's actually one of the things that I'm like the worst at.
You don't think it helps?
I think it does help. I'm just personally not very good at doing it. I do it, but I have to almost like force myself to do it and think about it. I almost feel like sometimes my mind moves so fast that by the time I'm done thinking it, I've only written like the first word of it, and I'm like, forget it.
Well, that seems like a pattern with you. You're just very, we say like EMT, you're used to getting out. Like, we use the word acute. Seems like you have a very acute mind where you're just going on to the next thing. Yeah. And maybe writing is more of a chronic,
long term. Yeah.
Well, yeah, maybe it's more of a chronic habit that it seems like you said yourself that you need to work on.
Yeah, I think that's an accurate assessment.
I mean, writing helps, but I'm totally with that, because like there's something in your mind that's so complex, and you're like, what is the point? Why am I doing this? But sometimes it's just like to rationalize it, like that whole thing with like therapy, when people go to see a therapist and they're just like, tell me your problems, and it's like that person is now vocalizing like what's going on in their head, and as they're doing it, they're like, I'm getting perspective. So that's my whole thing with writing. When it comes to the diary journal, I do journal too, but like it's when something's like really burning in my head and I have to like really think about it. And then I don't worry about it making any sense to like any third party. Like it's just I just write it down. It's super sloppy, and then I go over it and I'm just like, all right. When it comes to creative stuff, and it gives you perspective. And I do that with a lot of stuff. I write down my dreams every night. Like I do like that kind of thing. That's for like
for creativity.
That's for the lucid dreaming stuff. If you ever want to like practice lucid dreaming, you should write down your dreams. But yeah, when you're writing and you're not worrying about like anybody in the far off future picking this up and like trying to glean an opinion on you by reading it, if you're just writing it for yourself, I feel like it comes easier.
I think I do better praying than writing things down, because then I get to like say those things and they get to be said to someone, and it's someone who understands no matter what, and I know that it's going to be taken care of. Maybe not in the way that I expect it to be taken care of, but I will be heard, and things will progress.
That's beautiful, honestly. Because no, really, I think that's a really beautiful thing to say because, I think that's why a lot of people find strength from a God, whether it's a Christian God or a Jewish God or a Muslim God, it's just that, maybe no one around you understands, but you know that person does, and they're always around you.
Yeah.
Prayer is definitely a powerful thing. Firsthand, I could tell you that, it's definitely something that's really good for your spiritual life. But yeah, people have different ways of dealing with that kind of stuff. And,
Absolutely.
A lot of people reject the solitude and peace. A lot of people go further into the aggressive. I mean, that's like why a lot of people pick up fighting, or they pick up like some, like boxing and stuff like that. So we deal with it in a multiple ways, but I can only imagine the amount of stuff that you got to deal with, it's probably crazy.
I mean, your crazy is different from mine, though.
Right.
My mom was a high school English teacher. I could not deal with the stress of 30 high schoolers running around. Like, I couldn't do that. You put one person who's critically ill in my ambulance, though, and we're good.
Yeah.
Like, my mom can't handle the sight of blood. I can't, like, things are, it's, everyone's needs are different, and everyone's capacity, tolerance for stress is, we're not all on the same playing field.
Yeah, you just got to find a way to motor through it.
I mean, you're talking about strengths and weaknesses and people being tiered towards certain things. It sounds like, do you believe in working hard and overcoming those weaknesses to do something you really want to do, or do you believe you're meant to do something?
Oh gosh, this is another one where I believe both.
Really?
I think if someone, so I haven't personally dealt with anyone. I've had someone say in EMT class, yeah, I'm not the biggest fan of blood. I don't really like doing this specific piece of it, but I've never had someone say oh my God, I can't handle anything medical, but I really want to be an EMT. I've never had it be that extreme. But you hear stories of people that want to do that thing so badly, and I think if you have the drive to do it and that's really what you want, you will find a way to do it.
I agree. I feel like you can have which Greek philosopher was it Socrates? He had a stuttering problem, and so he would put rocks in his mouth and try and speak every day, and over time that resistance just allowed him not to stutter anymore, because once he had all the rocks out of his mouth, it was so much easier to talk. I believe you have the capacity as a human being to fit into any mold, but there's obviously restrictions. If you're 4 feet tall, you're not going to be in the NBA dunking on people.
Yeah.
But when it comes to overcoming a fear and stuff like that, it may be super hard, but you can do it. Now, when you do it, is the end result going to be you being the greatest at that? Maybe not, because you're still struggling with it back and forth. But in my philosophy, I believe everyone has the potential too, but it's going to be hard, man. That with Bruce Lee again, this guy would he used to punch for a living. So what he used to do is just take a bucket of sharp rocks, and he thrust his fingers into it, whack his finger into this bucket, and these sharp rocks would hit the surface of his hand. And over time, man, this guy could just punch rocks and just not feel it. And so that's what made him such a great martial artist for TV and movies and stuff. Ooh. But that's over years of training your body. Same thing with being a guitar player. If you don't want to use a pick, you just really, really train the tips of your fingers not to be sensitive. So it's the same thing with fear. I feel like you can overcome it, but that comes from intense exposure. And what happens then, who knows?
But I think that being said, if you do have a passion and a drive for something and you just enjoy it and you do well at it, I think there are people that are made to do what they're doing.
Right.
I mean, I have coworkers that are just the most amazing nurses that I've ever worked with, and they just walk into a room, calm the patient down, laugh with them, and they're simultaneously manipulating their blood pressure, their respiratory, all of these medical things at the same time, and they walk out of the room, and I'm like, how did you just do that?
Teach me.
That's talent too,
Yeah,
That's
and
talent.
so I think people are made for things, but I think that if you find that you're struggling with something, or you really wanted to do that thing, but it seems like you're challenged with it, I think people can overcome that too.
Okay.
Yeah, I don't know, but that's a really interesting question you pose, being quote unquote made to do something, or you're destined to do something, as opposed to working yourself into that track. I feel like there's exactly what you said, both. There's an opportunity for both. I'm not sure if it's as black or white. What do you think, though, since you brought it up?
Oh, yeah, I want to believe in the do what you want, work really hard, Because me personally, I mean, we had this conversation in the last show. I don't necessarily think I was born with any, like, God-given, attributes, but I do believe that I work hard, and I really hope that that's enough sometimes,
Yeah.
Yeah, man. We did talk about that in that show. We had another long medical discussion last episode. It was pretty cool.
But it was more on the oncology end, and I kind of talked about, I remember we were talking about me shadowing.
Yeah.
So I was talking about that guy, Bill, the anesthetist I was shadowing.
Yeah, it sounds like it was a powerful experience.
Yeah, he was a cool dude. Real cool dude. It's crazy. No matter what field you're in, if you talk to certain people, like some people just have it. Just have that ability to reach people in certain ways.
Yeah. I feel like there are definitely like some people that weren't made for specific things though. Like I feel like they're
You think
there's
that's
a
part of
saying,
God? God making people for certain things?
I would say so, yeah. But like my sister says all the time, like not everyone can work in medicine. Like we'll go to a diner and they'll mess up our order, and it's not a big deal. Like I get chocolate chip pancakes instead of sunny side up eggs. Who cares? And she'll joke around. She'll be like, "That's why not everyone's made for medicine, because if that were me and I gave like chocolate chip pancake medication instead of sunny side up medication, it could be death." Yeah. So it's. I mean, I think but I think that some people know that. Like I could never sit in an office and organize like how pipes are going to run into a building or how a building's going to get constructed. Like I could never do that, but I can work with people and I enjoy working with people.
Right.
And I think somewhere in you know that you're destined to work with people and that you love medicine, you love enacting that change, that impact upon people. And so I think it's just a matter of finding what fits all of those characteristics of you.
Totally. I mean, that's advice. I mean, that when I was in an RA, that I'd give to freshmen. When I was in RA, I just had like all freshman floor. It's just like, yo, man,
same.
it's like you got exactly. So you know how it is, and like sometimes I'll come into your room like, I still don't really know what I want to do, and it's just like, look, you have to like be honest with yourself and get yourself like in as many different boxes as you can, but also like be alone in a sense where you're not letting anyone else influence you. Like you talked about something inherent. I feel like the way that you get the inherent stuff out is like really being alone and like being honest. Like, what is it that I really want to do? Forget about what my parents say. Forget about like all this stuff. Like, what is it? What is it that's like inside me that like I really got to go follow and do? And that's hard. That's really hard, you know?
And it doesn't happen in a day or a week or a month or a one session sitting in your room. It's over time, and sometimes it hits you like a truck, and sometimes it's just a steady, consistent, wow, I really do enjoy that.
Right. And sometimes people like aren't even kids or college students, like they're adults. You know what I'm saying? Like in the case of the first guest that you brought on, you know, she was an architect. Yeah, Carly was an architect. And then later on in life, much later on in life, she's like, I want to be a teacher. And now she's having the time of her life. So it can happen at any time. But I agree with you what you're saying, like being meant to such a time as this.
You know, when someone has passion for something, you feel it.
Yeah,
I feel it with you in medicine. I feel just, you know, there's an aura that comes out of you when you speak. There's just like, you get a smile on your face. You get really into it. It's almost like you're not even talking to us anymore. You're just lost in what you're explaining, you know?
Yeah. But that's the thing is like it can happen at any time in your span. I mean, Dave, the guy that I run on the ambulance with out in Chatfield, he was a computer science guy, still is, for like 50 or 60 years. He just started doing medicine within the past 20. He became an EMT 20 years ago, and he's like mid-60s.
That is really inspiring, because I've come across a bunch of people throughout my 1+ years of being out of college, and you know, it's just, life is not as linear as they make it seem in undergrad and schooling in general. You know, you go through K through 1 through 2, 4th grade, 5th grade, 11th grade, junior year, senior year, graduate, first job. It all seems so linear, and then you get out here and just see, wow, like, it's really not. You know, there's so many options out here. And, you know, like, what was I being spoon-fed this entire time?
That's a really interesting perspective. I mean, structure. I feel like human beings in the beginning of their developmental stage, they need structure so they don't become complete people that are devoid of responsibility. But there comes a time where you have to shed like all forms of structure. I truly believe that, and like really carve out a path for yourself. And I don't know much about life. I'm young, you know what I'm saying? But like, I would agree with you in the fact that it's the opposite of linear when it comes to your passions and it comes to your careers. Like, it really is like carving out a path, and like you said, like knowing people, the people who you meet, I believe it's not coincidental. You know what I'm saying? Everything happens for a reason, and you meet people and you get into certain scenarios, and bad things happen and good things happen, and they all push you to your eventual career, your passion, your goal. And so that whole trust the process thing, like, it's very overused, but it's true. I mean, I feel like you really find inner peace when you understand that, like, if it's all happening for a reason, and you're out here in kind of like this open world game version of life, that all the stuff that is happening to you and the thoughts that you're having, it's all relevant. It's just pushing you in one direction, man. So, but that's hard for young people to understand. Back to the whole array thing.
I love that. That was like, wow. Yeah.
Nah, I'm just blabbing, but like, but I do believe that, and that's why I think it's really hard for young people to understand that in college. It's just like, how is this all going to work out? How? We always want to know how, and it's like, dude, it's not your, not to sound like condescending, it's not your job to understand how. It's your job to just to go and do
live it,
to move through life.
Yeah,
and that's what you're doing. Like, you're jumping both feet in.
You just gotta be in the moment as much as possible, and just know that, like, no matter what happens, you've still got, and that's what really comes home to me every single night, is I still have a heart that beats, I still have lungs that breathe, and legs that walk, and I am luckier than most because of that.
Right.
And that's really all that matters, is that I'm everything else on top of that is icing on the cake. You know, the fact that I get to pursue my passion and have a meal at night and have a roof over my head, that's where it's at. We're at a nation of like impatient nation. We need it right now. The gimme, like,
Totally.
I want to figure out exactly where I'm supposed to be right here, right now. And sometimes it just doesn't work like that, but the point is we're all still moving forward, and that's what counts.
Yeah.
That's awesome. I think that's a good place to end.
I think so too. I think we went on, I think, for like 2 hours at 7:45. I hope you're not missing anything, or.
Well, either way, we thank you so much for coming on the show. Seriously, you were awesome.
Oh my gosh, thank you guys for having me.
Yeah, we just really, you know, if you want to look in the camera, shout yourself out what you're up to. You want to talk about your shirts that don't matter again.
I usually do that portion of the show for like artists and people who are creating stuff. But if you have like an Instagram or like some kind of blog where you're chronicling your experiences, then you could do that. But if not, that's
I'm just
it.
living it.
No, I mean,
Just
Yanna,
trying to
thank
live
you.
it.
Yeah, totally. And Yanna, thank you for coming on, sharing your story, and above all else, just being honest and just being really cool about your life and what's going on and what you do, because it's interesting and people deserve to hear about it.
Well, thank you guys for doing this and for having me.
Totally. All right. Yanna, thank you so much. Ryan, thank you so much. This has been episode 25. Thank you for tuning in. See you next time.
Mountains may be high, mountains may be high,